Okay, so the next topic we have here is coping with pressure. So this is a really important, the second domain of the Oxford SJT we have here. So the important thing before moving to the questions, so these are the few rules you should read before starting the questions. I just get you the summary of it, so you able, so because in this kind of questions, so there are kind of your, so there's a kind of pressure on you, any kind of pressure. You're getting late, your friends or colleagues are late, and you have to make discharges. You have to choose this two or three things in between you. So this kind of the general theme of this kind of questions. So as you know, so however many demands your time, your prioritization, like you have to go to home, sick patient, you have to make the rationales of giving overs, whether to stay in the hospital. It depends upon the patient state. So keep in mind the first thing ever we do in all SGT that patient safety is our priority in every case. If you keep in this in mind, all the situation changes and answers changes depend upon the patient safety. So these are the few rules you can just read before starting the topic. Keep in mind the patient safety is the most important thing, your health is also important, and also keep in view your limitations as well. Being a FY1, consent is not your duty, though you can discuss details about the patient if it is your patient. So these are the few things you should know. So without further a delay, we can just jump onto the first question of the coping of pressure of the Oxford Handbook. So you are a new FY1 doctor on an orthopedic team. The morning ward round is running late, and both your consultant and registrar need to go to theatre. One patient has yet to be consented for the hemiarthroplasty after fracturing her hip. Your registrar tells you to make sure that she is consented in time to be a second on the morning list. So there are two problems in the question. One is your consultant and registrar wants you to get a consent. Third, the second, so there is a one problem. So consent is needed, and second, you cannot get a consult in simple. But this is a kind of a urgency in the question because it is on a second on the morning list, right? So keeping view this mind that the consent is required in this situation, and also you are FY1 and hemiarthroplasty consent you don't know. So keeping in this mind these two things, and let's read the option first. Consent the patient before doing any other job, complete all urgent jobs arising from the ward rounds, and then consent the patient. Explain that you are not sufficiently experienced to consent the patient for this operation. Ask an SHO from other team who can perform hemiarthroplasties to take consent. Agree to consent the patient and then ask experienced nurse to show how to do this correctly. So pause the video and mark your answers. So the best answer for this is C, D, E, A, and B. So you can just read the rationale from here, just pausing the video. If you want to read the first, I will explain you in a minute. So the as we know that the first thing is here that you are FY1 and you don't know how to consent it, and second you have to take a consent. So the first thing is C, obviously. Best thing is explain that you are not sufficiently experienced to consent a patient. This is the best thing to do in this situation. Simply explain to your registrar or consultant, whoever asks you to take a consent, simply tell that, okay, I am just don't have any capacity to do this. Second is D, ask your SHO because as I tell you before, the consent is needed in this situation. So we need to get it. If we can't get it, we need to get it from with the help. So ask the SHO from another team who can perform hip hemiarthroplasty. So that makes sense. So in this statement, it is mentioned that he SHO can perform this. So obviously he is eligible to perform a take a consent. So second option is B. E is agree to take a consent to the patient and then ask experienced nurse to show how to do this correctly. So this kind of one of a not a correct answer, but it is far better than the other two. So in this situation, keep in mind that this kind of question is not like which is correct and which is wrong. It is like what which is more, which is better than the worst one. So this is not a correct answer, but this is better than the other two because in this case you're asking from help basically. Maybe the nurse explained to you Okay, you can ask that SHO or any other doctor who have experience in getting consents for the hemiarthroplasty. So this is better than other two, which is 2. Okay, you are an FY1 doctor on call for the medicine. After seeing a patient with pancreatitis, you recall the need to take an ABGs. Unfortunately, only experience of this procedure was on a model 2 years previously, and you have never attempted to perform an ABGs on a patient before and not feeling confident about the success. So, situation in this here, one, ABGs is urgent. So, in the previous question, we need to get an ABGs. Simple as this. But the pressure in this situation is you have not done ABGs since very long, and even on the real human, just done once in the model, which is also really previous. So that's mean you are not really confident. So these three things are really important to keep in mind while answering the question. So just quickly read the options and then rank it. Call the duty medical registrar and ask them to supervise your first ABGs. Ask your FY1 doctor who is available and more confident with the procedure to help. Attempt the procedure but without warning the patient about your inexperience. Attempt the procedure twice after talking to patient and then ask for help. Oh, I just missed 10, which is wait until the end of your shift and then hand the job over to the night team. And he is attempt the procedure twice after talking to the patient and then ask for help if unsuccessful. So pause the video and mark your answer. So as we just trying to devise a strategy like for this ranking question, trying to find the most correct to you and most worst to you. So as for this, as we know that ABGs is necessary, like urgent as well. So the best option in this case is B. Ask the FY1 doctor who is available and more confident with the procedure to help. So in this case, FY1 is the most readily available doctor to you, which is makes sense. You're just asking the first nearby doctor, which is FY1, is asking the situation to help you in the procedure, who is more confident. So the worst one can be in the situation is B, because wait till the end of your shift and then hand the job over to the night shift. As this is a
Delay.
urgency, you can't delay the procedure. So in this situation, B is the best one and D is the worst one. Now try to finding the other which is closest to the A in this case. So the next option in this case is E. Attempt the procedure twice after talking to the patient and then ask for help if it's successful. So in this situation, you are attempting the procedure, which is good because as a FY1, you need a practical experience and your practical experience comes in this situation, and but in this situation it is better than the option number C, because in this situation you just not warning the patient. In this E situation you are just being honest to you and to your patient. You're just informing that patient that you might be unsuccessful and you might need more help if you are unsuccessful. So in this situation, so E is better and C better than C, and the order becomes B, E, and C. And these we already put it in the last, and so A becomes called the duty medical reg and ask them to super, because medical registrar is a busy person. So you just not uh, calling them again or bleeping them again for the duty which is FY1 duty. So trying to solve the problem by yourself first and ask the nearby help which is available to you. And all this procedure which is FY1, ABGs should be taken by the FY1. So try to solve. So in this situation, as ABGs is the problem, so you're trying to solve it by yourself. Okay?
Okay, so what's the order? Please repeat.
Order is B, E,
Mm-hmm.
C, A, and D. D is the worst
Okay.
one and B is the first, right?
Okay. Okay.
Okay, so so third one is, as if one doctor on call, you are briefed by the pathology laboratory about an abnormal blood results. They give you a value representing the severe hypernatremia. You do not recall very much about the hypernatremia and have never managed a patient with this problem before. So, as it case, you just briefed by the pathology lab about the blood results. Obviously, normally blood results are chased by the FI1. So they informed you that you received the bloods which shows a severe hypernatremia, and you haven't managed, it's kind of a difficult situation, and you haven't managed the patient, this kind of patient before. So this is your kind of limitation in this situation, and this kind of emergency for the patient as well. So what you should do? So options are: call the medical registrar, ask what to do, see the patient and check what they are well, and then call the duty medical reg, find a computer terminal and Google hypernatremia for inspiration, consult and hospital guidelines either in the form of paper or online, and last one is prescribe a loop diuretic such as Rusamol. Okay, pause the video and mark your answer. So one is very obvious in this situation, which is the worst one, I feel. As you are not very know how to treat it, prescribing a loop diuretics will be the least one. So we know that E should be the worst kind of in all the above options. So E is the worst. So trying to find it. So in this situation, the best answer is B first.
B.
So first you have it in this situation, just find a reports. You haven't seen the patient yet. You just find a report in this situation. So better is to just see the patient yourself and then call the duty registrar. Then call the duty registrar in this situation. Second one is find the terminal. Second one is D. Consult the hospital guidelines either in the form of paper form or online. And then call the duty reg and then obviously see find the computer. So I give you a little like flow of the like help if you need any kind of help, especially with the prescription. First trying to follow the local guidelines, which is a hospital guidelines, then BNF, then you go to the nice guidelines or even the Google, and Google is the last one. First is the hospital guidelines, then is the BNF guidelines, then is the nice guidelines, and the last one is the Google, or you can just simply Google the term. So that is the least reliable thing you can do this. So the order becomes B, D, and E, obviously the last one. Okay.
Yeah. Okay.
Next question is question number 4. You're on a busy surgical ward round. Your consultant tells you to order an urgent CT scan and make sure that it happens that morning, although you're not on your job list to do this. You do not think that it's a good reason for doing the scan. So, in this situation, one of your consultant in the ward round asks you to order an urgent CT scan. So, but you don't think or you don't find any reason or rationale for doing the CT scan. So, so this is your concern kind of with your consultant about the any investigation. So keep in mind the NHS promotes you. If you have any concern about anything, you should raise it. So this is always the better option. Then if you have any concern, stay quiet. This is the least and the worst option every time. So keep in this mind. So one thing, just read the answers and just discuss it. So ask your consultant what the scan is for. Tell the duty radiologist that you disagree with doing the scan, but you've been told it's an urgent. Explain to your consultant you cannot order the scan as you disagree that is inappropriate. Ask your colleague in your team whether they can explain why the CT scan is necessary. Book an ultrasound instead and then reconsider CT scan later depending upon its result. So pause the video and mark your answers. This is little ambiguous kind of not a really worst answer in any case, but I'm seeing one is the very best answer we can say. As I tell you this before this question, the always if you have any concern, just raise it. So that will be your best answer. So your consultant asking you, and you have concern regarding investigation with your consultant. So best thing is ask your consultant. So the best answer in this case is ask your consultant, but the scan is for, which makes sense. And the next best is if you are not able to ask your consultant, ask your colleague simply whether you are maybe not get that point which consultant by the consultant, but maybe your colleague can also, and it also colleague is available in your nearby ward. So best next is B. Ask your colleague in your team whether they can explain why the CT scan is necessary. Then is C. Obviously, in this situation, so these two are better option. You are just explaining. you're asking for help. C is explain to your consultant you cannot order CT scan as you disagree that is inappropriate. So in this situation, you are not asking rather than just explaining, and you're not doing a CT scan, which is required in this situation. As it is mentioned in the stem that it's an urgent CT scan, so this CT scan should be done. But as you are just not doing it, so this is the wrong answer. And obviously the rest two are also wrong. So better is, so the worst, so next is B. Tell the duty radiologist that you disagree that with doing the scan, but you have been told that's an urgent. So radiologists being radiologists will not able you to get a scan if you don't provide an if sufficient information for the scan. So this is just you just putting your responsibility to the radiologist, and this is not going to happen. And the last one is E, book an ultrasound instead and then reconsider CT scan later depending on its result. So just you wasting another resource of this trust, and then you have
Hmm.
to reconsider. So you're also putting a delay. So in this you are just wasting the resource. So that is why this is the last one in this situation.
Mm-hmm.
Okay. So next is fifth, which is Metron has raised an issue about our drug that you prescribe incorrectly. You prescribe a times overdose, which is fortunately was supported by the vigilant pharmacist and never administered. Nevertheless, our clinical incidence form has been completed and Metron is going to contact your educational supervisor. You feel that this error was caused by being overtired. So in this situation, you have done some mistake, which is like prescribing an overdose of any drug. And though it was saved by the pharmacist, but still your matron clinical incident form has already been completed, and your matron is going to contact your so and you feel that this error was happened because you are really overtired. So keep in this all stem and just read the answers. Tell the matron that the error was not your fault because trust made you work unsafe hours. Accept the personal responsibility and explain that factor you believe contributed to the error. Ask the matron not to contact your education supervisor as this was an isolated error. Use your e-portfolio to record the error and reflect on its reason so as to avoid this happening again. Ask to meet your education supervisor to discuss the error and your concern about the night rota. Okay, so pause the video and mark your answers. Best in this case is, we know that, is accept the personal responsibility and explain the factor that you believe contributed to the error. So, and in this fail, you also feel that this is error was due to, but you have just brittle having some kind of the excuse or kind of the reason why this error happened by the you. So that is you say that it due to the overtime, but you know that this is an error. So better is to accept the personal responsibility, but explain the factor you just contributed to. You believe that it's you just talking to the matron and obviously saying that okay, this is my responsibility, but explaining that why you thought why you think that this happened. So B is the best one. Next is E, asked to meet your education supervisor to discuss the error and concern about. Obviously, you're trying to solve the problem. So you're trying to reach to your education supervisor and discuss the error. So in this case, you're not hiding from the error. You're discussing the error and also regarding your concern about the night rota. Because in the stamp, it says that you have concern at this error because of your overtime. So E is the second one. And the next one is D. Use your e-portfolio to record the error and reflect on its reason so used to avoid this happen again. So in this situation, you are planning to record this error, but you're not doing anything at the present. So this happened to just so this happened to help you prevent this kind of error in the future. But this kind of this statement not helping you to the present situation, like you being overtired. So you're not doing anything in this situation. So this is B, the third one. The next is A. Tell the matron the error was not your fault because trust. So in this situation, you're just putting the blame on the trust rather than just accepting your fault and also doing anything about it. Just so this is the A. So why it is better than the last one, which is C? In this situation, you're stopping the matron to do his job, which should be everyone. If anyone, the senior, is trying to solve the problem and reporting you to the education supervisor, so this is his duty or her duty and her responsibility to do so. So in this The last one is just stopping the matter and is just making the thing worst. So this is the C is the last one in this situation. Okay.
Okay.
Okay. So question number 6. You are enjoying an evening meal with your friend when you remember ordering a blood test for an unwell patient, the result of which you forget to check over handover. So, in this situation, you are just sitting by in the evening enjoying your meal, and suddenly you realize you just forget to check reports of the unwell patient, which is like what to do now next. So, just read the options and then find out. Make a note to check the result first in the morning before the ward round. Call the duty FA1 doctor to the switchboard and ask them to check the result. Put the issue out of our mind, it's important, turn off after the work. Reflect on how this test was missed and resolve to develop system to ensure that such an error does not occur in future. Drive back to the hospital to check the result yourself. So, pause the video and mark your answers. So, as we know that patient is unwell, as we know the patient is really unwell. So problem is this, you when the patient is unwell, the first priority is always the patient safety. So in this situation, the best option is your B. Call the duty FIM doctor through the switchboard and ask them to check the result, which make really sense. That you have to contact the person on duty, which is obviously in the hospital. He is the first available person who can really check the result. So the best option in this case is B. So what could be the worst option? As we following the case, what could be the worst option? So option number C is your worst option. Put the issue out of your mind. It's important to turn off after the work. As it is the sake for the patient sickness and patient is really unwell. So this is the least appropriate option. This is the worst option you ever think as a good medical practitioner. So you cannot just take away this thought of not checking reports of a really unwell patient, and you also don't hand over, which is also mentioned in the. So this is the obvious wrong, and this is kind of an obvious correct one. B is obvious correct one, and C is obvious wrong. So let's find out what should be the next possible better option. So next one is E. Yes. So next one is E. Drive back to the hospital to check the result yourself. So this unpractically sometimes you feel like this is not really possible, but when the sake of the patient life, so you have to do whatever you can done unless it is done, because the patient life is on the risk. So if you have to go back to the hospital, you should check, because by doing this you have to just make sure you are checking the reports of an annual patient. So second best is E. Next is D. Reflect on how this test was missed and resolve to develop a system to ensure such an error does not occur. So problem is that these two are really problem, D and A. Why D is better than A? Just let me know. Let me tell you. Make a note to check the result first thing in the morning before the ward round. So actually, why D is better than A? The reason is because in this you are reflecting on that you have missed something and you're trying to improving the thing in the future. On the other hand, on in the A option, you are just taking it really casual. Okay, I just missed the report, I will check in the next morning. And don't and it is not really mentioned in the statement that you will not do in the future. So that is the reason D is better than A. So the final order becomes B, E, D, A, and C. Okay.
Okay, but what I thought was that in A, we are actually seeing
Doing
the
it.
test
Hmm.
result. Yeah, we are actually checking the result, but in D, we are just reflecting. So that's why I marked it. Can you please explain this? That why
Yes.
this?
So
Yeah.
I just also give you a little. So this D is the first wrong option as it failed to address the immediate patient safety. It is, however, the best of incorrect as it might stop similar problems in the future. A is the most
Mhm.
incorrect as it is introduced unnecessarily delay, and there is no guarantee that an abnormal result would have been recognized on time to treat the patient appropriately. So this is the kind of explanation like given in the SJT.
Mm-hmm.
So that is say in this it's just like kind of a just an open mind statement. Okay, I will check in the morning. So that is why I feel the Oxford. So this is we need to keep in the mind actually is just like we just all see the options like in the
Mm-hmm.
similar pattern. But keep in mind,
Mm-hmm.
try to read the option independently. So
Yeah.
this is
Okay.
what I like. Try to read every option independently. Okay. So this is
Mm-hmm.
next. Okay. So next is 7. An FY1 doctor with whom you work closely says she is concerned that you seems down and you have been so for a few weeks. You have been noticed that your mood is lower than the normal, but put this down to a stress and tiredness. You do not think that you are clinically depressed and are embraced, embraced by your colleague raising the possibility. So situation is this that one of your other FI1 colleague just observe you that you're feeling down. Look seems down, and you also notice that you are getting low moods these days. But you just
Mm-hmm.
giving your cop-up mechanism that you should. It is because of your stress, and you also don't think that you're feeling clinical depressed. So what should we do? What are the appropriate actions in this situation? What should you do when someone is just ask you, oh, you look down? So just read the options and just then we rank it. Clarify the nature and reason for your colleague concerns. See the educational supervisor at next possible opportunity to discuss your mental health. Make a routine appointment with your GP. Ask your FA1 colleague whether they think you are depressed. Use the depression screening tool to determine whether you require your drug treatment. So, pause the video and mark your answers. So, as we're doing the technique, trying to find the first best, what you find this is the best one. So the answer is obviously whenever someone is just saying you something, you need to ask and just more explanation. So best option
Mm-hmm.
in this situation is
A.
A. Clarify the nature and reasons for your colleague concern, which makes sense. That you have to
Mm-hmm.
ask whether why she thinks or why she thinks you that what are the reasons basically why she asks or she says to you this kind of situation. And the worst thing is using the depression screening tool to determine whether you
Yeah.
require a drug treatment. So it is very clearly that a medical practitioner in the UK cannot do self treatment, and also you one doctor cannot do the treatment of the any kind to the person who has any kind of relationship with them, any close friend, family member, you cannot do the treatment to that person. So you cannot do the self treatment and also don't do the treatment of the when you have where to whom you have a clear close relationship. So this is the wrong way, this is the best one. So we end up having three options. So what is should be the next best option? So the next best
E.
option is C.
Yeah.
Obviously, you know you are getting low mood and your colleague is just finding you, and maybe he or she noticing something that you might not be able to find about yourself. So better to just make an appointment with your GP and get yourself checked. And other thing, you can just ask whether just to see your, oh, so the next we just find A, C, and E is the last one. So the next option here is B is better than D. So
D.
how B is better than D? Let me tell you. So basically, according to the Oxford, which basically these two are really confusing, otherwise like it quite obvious. But the option here is why B is better than D. So see your education supervisor at next possible opportunity. So we need to know who is our education supervisor. Education supervisor is a person who basically the in charge of your every like clinical and non-clinical problems. You can do your rota, your consultant, your education. So everything is basically deal by the education supervisor. So he is a go-to person before going to big bodies like Medical Defense Organization and GMC. So if you're struggling with anything, so you can just simply go to the education supervisor. So he's a person who deal with everything of yours. But why it is and why D is worse than B is the reason is that asking every other colleague whether you are just feeling depressed is just not professional and it just not solve your problem. Like the Oxford says that asking your colleagues in a corridor or in the hospital about your medical condition, it's not appropriate as a medical health professional. So that is why
Hmm.
D is worse than the B. Okay?
Okay.
Okay, Ji. Moving to 8. After the emergency operation, patient with the colostomy, you are the first doctor to see the patient once he becomes the conversant, and he asks whether the bag is permanent. You are certain that colostomies can be reversed, but do not remember very much else. So thing is, you're just talking to the person who just wake up after the surgery, and he's asking you one very obvious question when every person get up from the anesthesia, find a bag and ask you whether it is a permanent or not. But the important thing is the last sentence. You are certain that colostomies can be reversed, but don't remember very much. So it's just like there's some knowledge in your head, but you are not really sure. So the important thing is giving false reassurance is the very worst thing ever in the STT. You just give what
Hmm.
you know, but you can't give a complete false reassurance, which is every the lost time. So this is important. So by keeping this in mind, ask just read the options. Tell the patients that this colostomy will be reversed. Explain that you are an FI1 doctor and cannot answer complicated surgical questions. Explain that colostomies can sometimes be reversed and that you are help find out plan in this case. Offer to ask your registrar to drop by later on to answer specific question. Put time aside to read about stomas so you can answer questions more fully next time. So pause the video and make an answers. So as we do, the best option in this case is by keeping in mind what I have just explained before the question is best answer is C, right? You just
Yes.
telling what is actually explain the colostomies can sometimes be reversed and that you will find help out when the plan is uh, and you will find out the plan in this case. It means you are just telling, yeah, it can be reversed, but you will find a plan because it is obviously these all the plans, colostomies is basically decided by the surgeons, not by the FI1. So you're just telling the real truth to the patient and also answering the question of the patient. So, and the worst thing is the very false reassurance, and you when you are not really sure. That is, tell the patient that colostomy will be the reverse. So C is the best one and A is the worst one, and just find the second best option in this situation. So you can just offer to ask your registrar to drop by later. So D is the second best option. As you saying that, you can ask your registrar about this, your question. So in this way, you just politely not answering the question, but you trying to help him by saying you can ask you one of your registrar about his or her question. So this is the second one, and the next one is basically E. So in this way, you are just trying to find a time to read the more, but it's not solving the situation. So it is just in between the worst option. And the first worst option in this, explain that you are an FY1 doctor and you cannot answer. So one thing, you are not being nice to the patient. Second thing, you are not answering the question. And third thing is, you every one doctor you should have the enough knowledge to answer some or not every but few answers of the patient. So this is your question number 8.
Okay.
Okay. So next one is question number 9. You are saying very unwell patient on your ward. He complaining of a chest pain and also become increasingly hypotensive despite fluid resuscitation. Over previous few minutes, he has started to become drowsy. Although you are a F1 doctor, you have recently completed an advanced life support course and feel confident in managing a acutely unwell patient. So, patient is getting deteriorating. Though you are FY1 and also have an ALS course done, what should be doing here? So, the Options are summon the resuscitation team, continue to manage the patient regardless of the clinical condition, call the consultant, call the SHO, and continue managing the patient unless he continues to deteriorate. So this is just if you get the answer, the options are really fine, simple. So pause the video and mark your options. So the first best thing as the patient is deteriorating. So this is a normal NHS procedure, or in any even in the everywhere world. When Whenever you find the patient is deteriorating, you need to call for help. So in this situation, A is the best thing, cause summon the resuscitation team. So you're calling for help, which means A is the best one. And B is the worst one because you continue to manage the patient regardless of the clinical condition. So as when you are an FY1 and also you are not really trained and you will equally good as your other senior members to treat a really unwell patient. So this is the worst one. A is the best one and B is the worst one. The second thing is C or D. It is B. Why B is better than C? The reason is SHO is available on nearby you. Consultants is not really available in the acute emergency. So better to ask which is really readily available in the situation. So maybe SHO were there in the hospital. He is the one person who can get to you quickly rather than the consultant. So A, B, and C, then E, and obviously B is the last option. Okay?
Okay. Okay.
Okay. Next one is 10. Your consultant asks you to meet her in her office. She tells you that she is concerned about your performance, specifically that you have sometimes arrived late in the wards around, and your level of knowledge is below her expectation of a doctor at your level. You disagree with this assessment as you've only been late twice and do not think that there is any particular gap in your knowledge. So, so there's one consultant says that oh you have been late, you are not up to the mark, and but you are disagree with the consultant as you think I'm just late twice and I'm feeling good about my knowledge. So this is like really conflict and the senior. So what should we do in this situation? So options are explain why you feel that her assessment is unfair and ask her to provide specific example to illustrate her concerns. Ask the foundation school about the possibility of changing consultant as there has been a relationship breakdown. Ask the consultant for advice on how you can act on her concerns and improve your future. Using your e-portfolio, conduct a team assessment of behavior round looking for an evidence of concern about your performance from other colleagues. Tell the consultant that you believe your knowledge has no worse than any other FY1 doctors and you won several prizes at the medical school. So pause the video and mark your answers. So the best obvious answer, so the best option in this situation is C. As this is the kind of first time your consultant just tell you, so simply just being a nice and ask being a junior doctor, ask your consultant for advice how you can act on her concerns and improve your performance. Rather just giving us arguments simply if this is the first time basically. So keep in mind there is no mentioning that you have been repeatedly informed in this. If that was the case, maybe the options this is not your first option. But because there are other questions as well where there this kind of questions has come. So in this is the first because don't assume anything in the SDT. It is what only what is which is mentioned in the STEM. So this is the kind of first time. So ask the consultant for advice how you can just act on the concern. So what is the worst option in this situation? So worst option would be B. Ask the foundation school about the possibility of changing consultant as there has been relationship breakdown. So this is the no way to dealing any conflict or any concern. So try to solve it rather than just ending that just throwing that relationship and just saying that we don't want, we need to change the consultant. So this is the worst one. C is the best one and B is a worst one. So trying to find the second better one. So second better one is, because A is the best one because you're just asking politely, but B is A is the second better one. Explain why you feel her assessment is unfair and ask her to provide specific example to illustrate. So why A is better than D? Because in this situation you are just involving other person before you just talking straight to the relevant person, right? So the relevant person in the case is your consultant trying to solve the problems with the relevant person first. And why E is worse than D? The reason is you just being arrogant about the stuff and you just not listening to the consultant. So E is worse than the D.
Okay, question number 11. You have always enjoyed alcohol, but recently you have been drinking more than usual. There is no reason for you to think that this has affected your performance, and you have never been drunk at work. However, a number of junior colleagues have commented on your alcohol intake, and one has told you that she is concerned that you are developing a dependency. As a result, you have begun to worry about your intake. Okay, so here in this situation, we like a doctor is enjoying alcohol or taking alcohol, but he thinks that this doesn't affect his performance as he is not drunk at work. But his junior colleagues have noted that he is becoming dependent, and after hearing their remarks, he is also worried about his intake. Okay, so what he needs to do in this situation? The problem is that he's likely developing a dependency, and he's quite worried that he might uh, become dependent. Okay, so what are the there are options from A to H. We will choose the three one which collectively makes a sense and solve this problem. Okay, ask a friend with whom you socialize whether he she thinks that you are drinking too much. Ask your FA1 colleague, FA1 doctors not to joke about your drinking, as you feel that this undermines your professional reputation. C. Use a validated assessment tool to determine whether you have developed an alcohol problem. D is make an appointment with your GP to discuss your concerns about your alcohol intake. E is discuss the issue with your education supervisor at your next meeting. F is stop drinking for weeks so to see if you develop withdrawal symptoms. G is think carefully about your reasons for drinking more than usual recently and consider modifying your drinking pattern. H is stop going out with colleagues and drink secretly instead to avoid damage to your reputation. Okay, now pause the video and mark the right one. Okay, the right one among these are B, E, and G. D is make an appointment with your GP to discuss your concern about your alcohol intake. Okay, so it happens that when all the doctors in UK are themselves registered with any GP practice or with some other doctor. So here are concerned about your health, like you think that you are drinking alcohol more than usual. So you are concerned about your health. So GP is the first person to contact you when you are concerned about your own health. Okay. So all the doctors in UK are themselves registered with some respective GP. Okay. So D is correct one. E is discuss the issue with the education supervisor at your next meeting, as this is likely to affect your work, as your colleagues have also noted, and this might also in future might also come into the notice of the patients. So that's why it's concerning, and it might affect your work. So your education supervisor is also a good person to discuss the matter with. Okay. So E is the next best option, and the other one is G. G is think carefully about your reasons for drinking more than usual recently and consider modifying your drinking pattern. So here in the last in the question's last line, they said that you have begun to worry about your own intake. So the person himself is thinking about his excess alcohol intake. So he must find out the reasons that why he's drinking more than usual, and he can reflect on them and try to avoid such a situation. Now we'll discuss about the wrong ones, that why they are wrong. A is ask a friend with whom you socialize, whether he she thinks that you are drinking too much. This is not correct, as your friend might take your side, or might not want to hurt you, so he must might not give an honest opinion. So asking a friend is not a good option. Asking the one colleagues not to joke about your drinking, so we are discouraging them not to discuss the issue of drinking or dependency with them. They are trying to make our they are trying to help us, or trying to realize ourselves that that we are becoming dependent on alcohol. And discouraging them and saying them not to joke about drinking is something that is not professional, and is not a correct one. Okay, C is use a validated assessment tool. As I told you that all the doctors are registered to another doctor, another GP for their health, so we can't take care of ourselves on our own. So we should not use any tools or cage on ourselves. They can only be applied to the patients, not to ourselves. Okay. So C is wrong here. E is also wrong. No, sorry. F is also wrong. Stop drinking for a week to see. Yeah. So we are putting our health at risk. We are if we stop drinking, and we might develop withdrawal symptoms, which could be risky. So we should not do it ourselves. Okay. And H is stop going out with the colleagues and drink secretly. Yeah, this also doesn't solve the issue, as we are not stopping the drinking. Okay.
Okay.
Okay. The next one is you have been working as an FMR doctor for 6 weeks but struggle with IV cannulation. In fact, you have yet to cite one successfully despite several attempts. You are concerned about the distress caused to patients by unsuccessful attempts, and your inability to cannulate is starting to have an impact on the length of your working day. Okay, so here the problem is IV cannulation, that despite of our working continuously in a ward for 6 weeks, we are unable to cannulate successfully. And this problem has caused distress to some patient because of unsuccessful attempts. And also we are taking too much long time for cannulation, which is affecting our quality of work and impact on the length of work. Okay, so what could be done here?
Mm.
Options are: ask the colleagues to cite IV cannulation as often as possible until your ability improves. B is use your e-portfolio, reflect on what is that you are finding difficult about IV cannulation and how you can overcome this. C is ask a senior colleague to supervise a series of cannulation attempts. D is avoid trying to cannulate patients with difficult veins and ask colleagues to see them instead. Is consider modify career aspirations to specialties that are less procedural. F is continue to practice, recognizing the procedure will become easier as you do. G is attempt to cannulate each patient no more than once. If unsuccessful, bleed the duty anesthetist for assistant assistance. H is tell every patient that they have difficult veins, so that their expectations of success are set low from the outset. Okay. The best options here, pause the video and mark the answers first. Okay. So best one among these are B, C, and F. Okay. So why they are right? In B, they are saying that we are building a e-portfolio, and here the person is reflecting why he's finding it difficult to have cannulation. So this is a good approach, that whenever if a doctor finds something that he thinks is he's not doing right, or he's unable to do, he must find out or reflect why he's not able to do such things, so that he can overcome such weaknesses in the future. So B is good, that we are reflecting on ourselves. Okay. And C is ask a senior colleague to supervise a series of cannulation attempts. Yeah, this is also a safe approach. Then whenever we are cannulating, we must ask a senior to supervise, so that he might guide us and our cannulation attempts might improve. And F is continue to practice, recognizing that the procedure will become easier as you do. Yeah, practice makes a doctor perfect. So he must practice. Okay. So IV cannulation. Let's focus on this. That IV cannulation is something that all the FMN doctors should do. So eventually he must it's only 6 weeks in the ward, and eventually, as a role of FF1 for a year, he might come across such cases frequently and daily. So he must not run from this IV cannulation. So the other wrong answers, like in the first one, that he's telling another colleague to do. And in option A is telling his other colleague to do the IV cannulation, and also in the option D, he's trying to avoid cannulate the patient with difficult veins, and in also in the option uh, H, he's sorry,
Telling lies.
not in option it in option G, he's also telling that that he will tell the assistance of he will ask for the assistance of the anesthetist. That in all these options, he's not doing it himself, he's trying to impose such duty to the other person, so that's why they
Mm,
are wrong answers. And also in H, he's blaming the patient, that he will tell the patient that your vein is difficult, that's why I'm unable to cannulate. So this is also wrong. Okay.
yeah. Okay, good.
Okay, so 13. You are a lone FF1 doctor seeing an elderly patient on the ward who is hypotensive despite giving IV fluids. You are concerned that the only intervention you know for managing hypertension has not worked in this case.
Mm,
So here the problem is that F1, you are F1 doctor and an elderly patient is hypertensive, and you only know one treatment of hypertension is that to give IV fluids. And as an F1, you do not know anything else, and the patient is not becoming normotensive despite taking the IV fluid. Okay, so what we are going to do now? Option A is ensure that the patient has a valid not for resuscitation order in case they suffer cardiac arrest. B is accept the patient is normally hypertensive and avoid further IV fluids. C is call your SHO or other senior doctor for advice and assistance. D is ask the nursing staff to put out a pre-arrest call. Begin administering inotropes if further fluid challenges fail to increase the blood pressure. Ask the patient's family to attend as their relatives is probably dying. Ensure that you have good IV access and give another fluid challenge. Monitor the patient carefully for signs of deterioration. Okay, so it's an emergency situation. If we doesn't treat the hypertensive patient, he um,
that's
might collapse. Yeah. So we should deal with this situation then and there. And what are the best approaches among these options? The best one are C, G, and H. We are becoming a safe doctor by choosing these options. C is that we are asking the assistance of senior, and G is I told you before that as an FM1 he only knows IV fluid as a treatment of hypertension, and he has given in one fluid, and he might what he know is to give another fluid, so that's also a reasonable answer. Then ensure that you have a good IV access and give another fluid challenge. Okay. And H is he what he can do best in this situation is he can carefully watch for signs of deterioration. Okay, so it's also a good one. So while others are wrong, let's discuss. A is ensure that the patient has a not for resuscitation order in order in case they suffer cardiac arrest. Okay, so here we are not doing anything, we are just letting the patient um, suffer a cardiac arrest, and we are just waiting for that. So it's wrong. B is also that we are avoiding any further fluid, then we are just not doing anything. Um, D is that we are asking the nurse to put out a pre-arrest call beforehand. Patient might not go into the cardiac arrest. He might be benefit from another fluid. So it is also a premature activity to call a pre-arrest, to have a pre-arrest call beforehand. Okay. And E is, as I told you before, that he only knows IV fluids as the treatment of hypertension. So giving inotropes as an FF1 is not suitable here. So E is also wrong. Okay. Next one is you are feeling stressed as the on-call FF1 doctor and have just found yourself becoming angry with two sets of relatives in quick succession. Okay. So here the problem is that FF1 doctor feels that he is becoming
angry.
angry, or he's not dealing good with the relatives because of his workload. Okay. So what he is going to do? Options are take a short break to regain perspective, ask a colleague to help share your work if they are able, resolve not to speak with any more relatives on this shift as your priority must be unwell patient, apologize to the relatives so they are unlikely to complain. E is consider what factors led to the altercations and address these are as far as possible. Ask the security or the nursing sister to remove the relatives so they are so you are not interrupted again. Manage your frustration by berating a medical student because he is unable to cannulate a patient. Check the time, it is nearly time to go home.
Oh,
Okay.
that's time to
So,
go.
yeah. So, the best one among these are A, B, and D.
Yes, good.
These, okay, these are, I think it's a clear one. Like, we'll take a short break, we can ask a colleague to help us. And E is consider what factors led to, like, reflect why we are becoming too much angry or why we are being stressed. Okay.
Good.
Other are obviously wrong.
Mm.
Yeah.
Next, 15. This is a
Yeah.
one easy one.
Yeah. Your manager
Oh,
emails to say that a written complaint has been received about your management of a patient seen in A&E. This concerns a patient whom you saw after a fall, but you do not document a proper examination. A fractured hip was missed for 72 hours. Okay. Here, an incident happened that have seen a patient a couple of days ago, and you didn't have time for proper examination, and you missed a fracture for 72 hours, and you received an email about a formal written complaint. So what are the options here? Edit the notes to include features that you honestly recall at the time persuaded you that the patient did not have a broken hip. B is edit the notes to include features that were not present but might make your mistake easier to forgive. C is submit a factual description of events within the deadline imposed. D is think honestly about the case and what you would do differently in future. Ignore the email as you are rotating to a new hospital next week. Explain that you were very busy that day and could not thoroughly examine the patient. Document your formal response and ask to be informed of the outcome of this complaint. Submit a response whenever you are able. The clinical care of your current patients comes first. Okay. So the best options here are C, D, and G.
B?
C, D, and G.
D. Okay.
Yeah. It's also kind of a straightforward one. A and
Mm.
B are obviously wrong because editing the
Edit
notes
the
is
note,
not
yeah.
allowed. Yeah.
Mm.
So A and B are easily eliminated. And also, this is something that whenever we find we receive a complaint about ourselves, we should respond then and there at the earliest possible time. We should not wait. Like in age, they are saying submit a response whenever you're able. No, this is not the case. We should submit the response at the earliest possible time before the deadline. Question number 16. Your consultant calls to ask you to relocate a dislocated total hip replacement for a patient on the orthopedic ward. He mentions that you should give IV sedation first. When you tell him that you have never sedated a patient before, he tells you to use propofol and ketamine and then hangs up the phone. Okay. So problem in this question is that you are asked to do something which F5s normally don't do. Even F5s or F5s are not it's not a common practice for them to give sedation to a patient. And also hip replacement or hip to relocate the dislocated hip is also not the duty of FY1. It is a duty of someone senior. Okay.
Mm.
So it is clear that we can't do the thing. So there are options from A to H. We'll read and then we will mark the three most appropriate actions to take in the situation. Okay. A is
Mm.
call the consultant back to clarify what doses you should use and what movements are necessary to replace the dislocated limb. B is call the consultant back to say that you're unwilling to do as he asks. C is use the British National Formulary to determine doses. D is sedate the patient and then find the duty orthopedics registrar to if you are unable to relocate the dislocated hip. E is contact your education supervisor at the first possible opportunity to discuss this request. F is contact other senior orthopedic colleague if your consultant doesn't answer or offers no further advice. G is attempt to relocate the hip without using sedation. H is sedate the patient and attempt to relocate the hip. Okay. Now pause the video and mark your answers. The best one among these is B, E, and F. So the answers to be eliminated are quite clear. As I told you that you are not supposed to replace the dislocated limb as FF1. So A is eliminated by this rule, and also the other options like D, G, and H. In all these options, they are saying that relocate the dislocated hip, which you can't do, so they are easily eliminated. And so and also C, they are in C they are saying that use the BNF for the doses. We are not going to sedate, so we don't need to know the doses. So C is
Hmm.
also eliminated. So we are left with just three options: B, E, and F. Okay.
Okay, so I'm just thinking, it just making a sense like you're
Hmm.
well, when we say that collectively three, it is like present,
Hmm.
solve the problem, and in future what you should do. So
Hmm.
because
Hmm.
every time we just collect, it becoming kind of a like trick to solve the problem. So even the future thing is correct in this situation, right? You said
Hmm.
that contact your future as the first possible opportunity to discuss this way. So this is not like in the present problem, solving the present problem, but it will give a long-term solution as a in
Hmm.
future. So this can be
Hmm.
also make a little technique like third option, or what is the solving the problem, what is in a present situation, even the future, that
Hmm.
also
Hmm.
take part as a whole. We always say that collectively three solve the problem as a whole. So this is like solving the problem as a whole. So we can also say that like maybe
Hmm.
that in one thing should like can be in a future no matter what.
Yeah.
Okay.
Right. Hmm. Okay. 17. A patient asks you why you are ordering a CT scan to eliminate stroke as a possible cause of her symptoms. She is worried about radiation risk and wants an MRI scan instead. You do not recall precisely why CT is used as the first line investigation for stroke. Okay.
Uh-huh.
So this in this question, you know that CT scan should be used at the first place as a first line investigation instead of MRI. Patient request MRI. You know CT scan is important, is the first line, but why it is first line investigation, you don't know, and the
Hmm.
patient is asking for an MRI. Okay. So to solve this problem, there are three options. There are a set of a few options, and we'll need to select the three one. Okay. A is tell her that CT is probably cheaper than MRI. B is explain that you are a junior doctor and cannot answer questions about complex investigations. Okay. C is call the duty radiologist and hand the phone to the patient so that they can have an informed discussion. D is explain that you do not know the answer but will speak with someone to find out the reason. E is carefully explain the risks and benefits of having a CT scan, looking up information first if you are uncertain. F is tell her that she cannot have an MRI and clearly document that she refused the CT scan. Ask your consultant to visit on his ward round the following week to discuss management option. Use this question to identify a gap in your knowledge and read around the subject during a spare moment. Okay. So the three best responses in this question are D, E, and H. Okay.
Yes.
So they are collectively solving the problem as we are telling this patient that CT scan that we do not know much about, but we will speak with someone to find out the reason that why CT is the first line. And we know the risks and benefits of the CT scan, though we don't know that why it's the first line. And so what we know, we will tell the patient, and we will also then the other part of the STEM in E option is looking up information first if you're uncertain. We'll first look up the information and then explain the risk and benefit to the patient about the CT scan. Okay, so it's
Okay,
also acceptable.
like you say that it is solving one thing at the
Yeah.
same time and also the other thing, and the age one which shows that you will try to do in the longer term as well, what you will do in the longer term or in the future.
Yeah. Long term is that we will read about it, identify a gap, and we will self reflect in age option.
Hmm.
Okay.
Yeah,
So
great,
these
great.
three are solving the problem. Okay. And the and those which are not correct, I think they are quite straightforward. In these, we are just telling like we are telling him false information like city is more cheaper and like irrelevant things that we are telling in the other options.
Hmm.
So I think it's quite straightforward. D and E and H.
Yeah.
Okay, should we
Okay.
move to the next one?
Yes.
Yeah, okay.
18.
18. Your registrar suggests one morning before the ward round that your appearance is inappropriate. In particular, he says that you are showing too much of your chest and are wearing a watch. Okay.
Mm,
So, in this is a situation of like infection control. Um, in many hospitals, like in most of the hospital, we are not supposed to wear a watch, and there are some particular dress codes like bare below elbows, and do not wear a watch, and tie up the hair, and should not wear too much revealing clothes. So it's the trust policy. So we should, if someone tells us that we are not binding or we are not acting upon the trust policies and we are not following, then we should take it as a positive, take it in a positive way, okay, rather than being offended by the comments of our seniors. Okay. So here a senior tells us that we are registrar tells us that we are not we are wearing a watch and are not wearing appropriate clothes. So what should we do? There are a set of options. We'll select the three one. Okay. Option A is remove the watch immediately as it conflicts with the trust policy. B is explain that you have not realized that your dress was inappropriate and will consider this before coming to work the next day. Okay. C is point out that your consultant also wears a watch. D is wear more revealing clothes the following day to show you are free to interpret the trust dress code yourself. Okay. E is tell your registrar that he should be more interested in your clinical ability than your choice of clothes. F is decline to participate in the ward round because you have been insulted by the registrar. G is tell your consultant that your registrar was insulting and bullying before the ward round. H is seek feedback from other colleagues if you are uncertain whether your clothes really are inappropriate. Okay,
mm,
now pause the video and mark. I think it's also a very easy and straightforward one. The options here are A, B, and H.
yes.
Okay, right?
Mm. Oh,
If
yeah, this
they are
is
saying
kind of
that
few
our
easy ones.
yeah, easy one. If someone is saying that our dress code is not according to the trust policy, then we should try all the
Note it.
possible ways to make
Mm,
it accordingly. Okay.
okay.
Okay, so A, B, and H fulfill this that we are removing the watch immediately, and next day we are dressing up more accordingly. And H is we are also gaining feedback from the other colleagues, so they might advise us and tell us more about the dress code, okay,
Okay.
which we can follow in the future. So H is
Another
about the
other
future.
and others are really
Yeah,
obviously wrong.
yeah, there are obviously wrong. Yeah,
Okay. 19.
19. You're on call at night and have not eaten since coming to work. You're very tired and can feel yourself nodding off to sleep within a few seconds of sitting down. You're about to break away for a sandwich when a ward sister asks you to write two drug charts for patients who have just been admitted. Okay. So here the problem is that it's your lunch break time and you have been waiting for your lunch break as you're feeling sleepy and you think that it might risk the patient if you don't eat anything and don't go for a break. But a ward sister asks you to write two drug charts for the patients. So, how we deal with such a situation? There are some options. Let's read out. Explain that you were planning to go for a break. A. B is offer to write the drug charts later on. C is explain that writing drug charts is not a job for the on-call doctor and is best left to the ordinary ward team instead. D is have a quick look, prescribe any urgent drug, and then go for for your sandwich. E is ask the nurse to complete the drug chart for you to sign when you get back. F is ask how urgent the drugs are and use this information to prioritize the task. G is tell the nurse that she should not bother you for such a routine task. H is complete the drug charts as requested. Okay, so important thing is that we should go to our break as if we stay for longer, it can be dangerous for the patient. Okay, so keeping in mind the patient safety, we should ourselves take care of our break and our rest time. Okay, and the other thing is that these drugs might be very necessary or might be the urgent drugs, and if we don't prescribe this timely, it might lead to the lead to more serious consequences and could be a risk to the patient health. Okay, so these two things are those which we should keep in mind. And also one more thing that we should keep in mind is that drugs are not something that we should prescribe, just have a look and prescribe immediately. We should take time and understand properly and then write about the drugs. It's not
Hmm.
something that we should do in a hurry. Okay,
Hmm.
so the best option among these is A, B, and F.
Yes.
Yes. A is
Okay.
that we are telling her that we are planning to go to a break. B is we are telling her that we will write the drugs later on.
Hmm.
Okay, and in F we are telling her, as I told you, that these drugs might be the urgent or the life-saving drugs, and if we don't prescribe on time, it might cause a very serious risk to the patient. Okay, so we'll ask how urgent the drugs are and use this information to prioritize the tasks. Okay.
Hmm. So 20.
Yeah, the last one. You know that you do not always communicate well when feeling stressed and want to avoid the impacting on your relationship with colleagues. Okay. You know that you do not always communicate well when feeling stressed
Hmm.
and want to avoid this impacting your relationship with colleagues. Okay,
Okay.
so
Okay.
here the situation is that you know that whenever you feel stressed or you are overburdened or have something back in your mind, you do not communicate well, and you don't want the situation to last long because this impacted relationship with your colleague. So you want to improve such a situation. So what
Hmm.
you're going to do, how you'll improve the situation? A is use team assessment of behavior rounds and informal feedback from colleagues to gauge your success at managing stress. Okay. B is tell other team members early on they should avoid making you stressed. Okay. C is ask other FF1 doctor on your team to be responsible for shared tasks to minimize your workload. D is make sure that you always go home at 5 o'clock. E is try to streamline your work effectively so that you are not left with lots of tasks to complete at the end of the day. F is talk to the senior colleague early if you think that the workload is getting on top of you. G is drink alcohol to evenings to loosen up. H is ask human resources for time each week to attend yoga and relaxation classes. Okay. So we know that when we are overburdened or there is a lot of work at the end of the day, then we feel stressed and we do not communicate well with our patient in such situations. So we want to deal with such cases. So how to deal with is A, E, and F answers.
Sounds.
Yeah.
Yes.
Yeah, A is that you're seeking help from your colleagues, and like you are self-assessing yourself and also gaining feedback from the colleagues um, on how to manage the stress. Okay, and E is that you're at the start of the day you're trying to streamline all your tasks so that you're not left with a lot of tasks at the end of the day. And F is you're talking to your senior colleagues. If you feel that the workload is too much, then you can ask them to lessen the workload or divide it in the among other colleagues as well. Okay, and the other ones are obviously wrong. I don't think anything is like near to the correct one. So
That's it.
yeah,
This is
A
it.
and F. Yeah,
Okay. So that's it. We're ending
yeah,
the first 20 and we'll try to end the next 20 soon.
yeah.